Ambulance service. Is the patient breathing?
We're back on the front line,
West up, here to mobilise.
following Scotland's paramedics.
Top floor fire in a block of 4.
Got an 80-year-old female who's fallen outside.
He's been stabbed. Is the attacker still nearby?
I need you to say the word now every time her chest rises.
Every day, they save lives.
Hi there.
We're the first people that people see when life can get quite desperate.
You're okay, you're not going to fall?
You sure?
100%.
And every day, they face new challenges.
Oh, they're going in with shields.
We're expected to dip into everything: mental health, trauma, medical.
But now we're being stretched even further.
Unbelievable.
Listen, I can understand you without swearing.
I laugh in the face of danger.
Sometimes you're seeing people at their absolute worst.
You're fine. You're fine.
Listen, you're in safe hands now, all right?
At the end of every shift, I can go home knowing that I've made a bit of a difference.
This is Scotland's ambulance service, serving over 5 million people in every corner of the country. This time, we're with crews in Edinburgh, Millport, and Inverness.
Bleeding from one ear and holding ribs and left side of body. Informant advised thinks may be head injury. This patient is acting confused. Female having difficulty breathing due to rib injury.
Right.
Police are en route.
999 route activated.
4 hours into their shift, crewmates Heather and Callum are en route to an emergency call for a woman who is reported being assaulted.
Doesn't say how old the person is. She'll be going in anyway. She's got a head injury. She's probably cracked a few ribs as well.
Sounds like she's taking a bit of a beating either way.
I've personally not experienced many domestic abuse calls. I don't know if you have.
It's not a regular call that we get. Not physical, maybe verbal abuse, but not physical abuse.
No.
Was it bleeding from the ear?
Bleeding from one ear and holding ribs and left side of body. So he's obviously, I'm assuming it's a he, it could be a she.
It says female, doesn't it?
Yeah, but whoever's assaulted her,
All right, aye.
I'm hoping the police will be there before us. Any abuse or assaults, I'm very apprehensive. There's a cyclist there. No helmet on, no lights, dressed in black.
I don't even let my son go on his bike without a helmet. Gives me the fear.
This sort of work certainly always interested me. I think it offers such a varied kind of day-to-day experience. You know, some days can be quite stressful. We enjoy our humour, but we're also able to switch on to the more serious tasks at hand.
Is it this left?
Yeah, it's this next one. Oh, there's a, you see the...
Police car, yeah.
Yeah. I would go ahead of the police.
Heather and Callum arrive on scene 17 minutes after receiving the call. Police are with the patient in the street.
He's waving, yeah. No, this is kneeling.
I'm going to block this whole road.
Yeah, just do that.
The whole scene seemed a bit chaotic with lights. The patient was lying in the road with a space blanket on.
Lots of people around.
Lots of people.
She's on the deck. That's her mate that's on top of her.
When you arrive at these incidents, you kind of have a quick look through the windscreen to see is it safe to actually leave the ambulance, because there was lots of people out and about. There was police there with bystanders.
Yeah.
Probably about 5 other bystanders around the patient, so it was rather chaotic. What I'm trying to get is, I want you to get up and into the ambulance, and then you're going to lie on our bed, and then you won't have to move again, all right? So it's just getting off this cold floor. That's my aim, all right? So I can have a proper look at you and see what that is.
My head, I get dizzy.
Okay, no worries. We'll help you. We will help you get up, okay? So all you need to do is keep your legs like this. Give me your hand. Give me your hand.
Can I have a second first?
She was lying on the road. It was raining, it was cold. She was complaining of pain to her side. She was holding her chest and she was finding it a wee bit difficult to breathe. My sole instinct is, let's get her out of here and get her into the safety of the ambulance, away from everyone. The longer you're on
I know.
you're getting cold, right? And that's my concern, right? We're trying to get you nice and warmed up in the ambulance, okay? But the only way to get you off the floor is for you to help. That's it. Well done. I'm going to...
Put your hands behind your shoulders,
Yeah.
right? And
Right.
we'll get you up onto your bum, okay?
Oh my God!
Right, stand.
Can I just wait 2 seconds?
You take your time. You've got to be able to kind of adapt the way that you're acting to the environment. I don't think she would have responded very well that evening to someone being quite assertive with her.
The quicker we get you on your feet, we've got you. We won't let you fall. Right.
Oh my God!
Now, give me this. Right, are we ready? Right, right, ready? Right, so 1 after 2. Right, we're going to go up on 3.
That's not a good idea.
Okay.
Lift arms to this rope.
Right, so pull up
Give
with
me
me.
2 seconds. Please, just wait. So I'm patient. Okay, let me get my feet in order.
That's it. Perfect. You're doing grand. Well done. Well done.
With temperatures dropping, Heather and Callum must get the patient, Shelley, into the ambulance so they can properly assess the extent of her injuries.
Absolutely brilliantly.
Oh my God!
Absolutely brilliant.
No!
Right. Listen, we've got here.
Only got a few steps to go.
We've got here, and then you're lying on our bed, right? And then you don't have to move again, right? Perfect. Brilliant.
Grab the side of the door.
Right, I've got you.
Go on in. Up you come. Another step.
Perfect.
Another step. Another step. Right, jump on there. We'll get you a blanket because you're cold.
Cold.
Across Scotland, over 4,500 999 calls are made each day.
Bear with me, please. Right, just bear with me. Is the patient awake?
In ambulance control, Chloe's in the middle of her 12-hour shift.
Right, okay. What's the address? Right, you need to bear with me. What's the address? And the postcode, please. I think there's an element of frustration of people panicked. They maybe don't realise the questions that we're asking them. There's maybe a lot going on in the scene, so that can then distract them a little bit. So it can be quite difficult. Tell me exactly what's happened. Right, okay. You mentioned about a peanut allergy.
The caller is with a man who is suffering an allergic reaction to peanuts.
I'm going to take you through some further questions. This does not delay in help. It's information for the ambulance crew, okay? Now, is he responding normally? In blotches? Right. Okay, when did this start? Allergies can be a really difficult call because it's hard if someone's not had a severe allergy before, so they maybe don't realise what's severe. Has he ever had a severe allergic reaction to the same or similar thing before? Right, okay. Does he have any... Okay, I need you to be... I want you to be reassured that help's coming as quickly as they can for him, okay? So just be reassured by that. It's the closest available ambulance. Allergies tends to be a very high priority call for us because we just don't know what their condition's going to be like. You can deteriorate very quickly. You could be sitting there talking 1 minute and then slowly your airways could be closing up. Now, does he have any specific injections or other medicines to treat this type of reaction? He's got an EpiPen, and have they been used yet? Okay, now tell him to use them now. Right, I can give you some instructions on how to use it, okay?
For the EpiPen, all the instructions are on the protocol, which is so it's great because it is giving you the instructions. You don't want to cause the caller an injury if they accidentally prick themselves with the needle. So having it all right in front of you and you telling them step by step on how to use it, it just makes the whole process a lot more easier for the caller, getting them this medication as quickly and as safely as we can. So it's the safest thing, okay, that this will be safe for him. Is it being prescribed for him? Is this medicine prescribed for him? Right. Okay, take a deep breath. The help's coming as quickly as they can. Now, is he standing, sitting or lying down? Right, okay. Please tell him to sit down, okay? The medicine may come unsteady on his feet. Right, just listen carefully and I'll tell you how to use the injector, okay? So first, remove the EpiPen from the plastic storage tube. Now what I need you to do is hold the injector tightly in the middle of your hand, okay? So with the orange tip facing down, do not touch the orange tip. Right, tell him just to bear with you, just so now with your other hand, pull off the blue safety cap, okay? This will unlock the device. Do you understand me so far? Okay, now jab the orange tip firmly into his outer thigh and hold it there for 10 seconds. You should hear it click. Right, tell him that we don't want these symptoms to come back. Okay, so tell him at the moment this is going to help his symptoms. Okay. The patient himself was very reluctant into using his own EpiPen. He had his mind made up that he didn't want any needles going into him at all. I know, but we all... Right, listen to me. We don't want your symptoms to come back and get worse, okay? We're only going to do it for 10 seconds, okay? The help's coming as quickly as they can. So please just that's why it's important that we give him the EpiPen. So at the outer thigh, yep, so jab it into his outer thigh, hold it there for 10 seconds. You should hear it click. I'll time you, okay? You're doing really well, okay? So just keep it there, 10 seconds. I think the mum was happy for it to be administered because that was the instructions that we were given. She knew that this is what needs to happen. Sit down, okay? You're doing really well, okay? Well done. Now carefully put the injector back into the storage tube. So the orange end first and then screw the cap back on. Save it for the ambulance crew, okay? So I need you to give it to the ambulance crew when they're there. Now I'll stay on the line with you as long as I can. Watch very closely and look for any changes. If he becomes less awake or starts getting worse, tell me immediately and tell me when the ambulance crew's right with him. They're coming as quickly as they can. You're doing really, really well, okay? How's he doing? Okay. Just keep reassuring him, okay? Just keep sitting down. Nice, slow, deep breaths in through his nose and out through his mouth. Doing really, really well, okay? If you feel he starts getting worse, just tell me immediately. They'll be with you very shortly. Like I said, it's the closest available crew. If they're having difficulty with their breathing, you just don't know how bad that's going to deteriorate in the next couple of minutes. So you just stay on the line with them, monitor their condition, touch wood that it's absolutely fine until the crew get there. Just knowing that you weren't physically there being part of it, but you were still there being a part of it as well. Yeah, it can be all rewarding. Is that the ambulance there? Right, I'll disconnect the line and I'll leave you with the crew. Take care now, okay? You're more than welcome. Bye-bye now. Bye. So he's never had to use his EpiPen before, but he's allergic to peanuts. But he was not keen for getting that EpiPen into his thigh at all. Not keen for it.
All right, get your bum down there. Swing your legs up.
Give me a second. Sorry, my head hurts.
I know. We're going to have a wee look at that, okay?
In Inverness, crewmates Heather and Callum are treating a patient who has been found on the street after a reported assault.
Give me just a...
All I want you to do is just lie back and relax.
No, not like this.
You can't really see many injuries in the dark and rain, and it was cold when we got her into the ambulance. You could then see with the lights, her hair was really kind of messed up and there was a couple of bruises around her face. Just need to concentrate on your breathing. Nice and slow. You're absolutely fine, okay? We've got you. Just relax back. That's all I want you to do. Okay? And then we'll have a proper look at you. All right, we're going to take your blood pressure. Okay? That's it. Well done. I know. Right, I'm just going to check you over just up the top here. Have you got any neck pain or anything like that?
I have a sore head, that's all.
Okay. Where is it that's sore? Can I just unbutton yours just for
Everywhere I
a minute?
breathe, it hurts.
Tell me what's happened.
There's a reason why I'm not with my ex-partner.
Okay.
And I'm a good person, I've moved on with my life and things, and we stayed friends. And then he just was crazy all of a sudden.
We felt it would be better for me to be in the back, just to be a female to female. Not saying that you
Not
were
at
going to
all.
be.
Not at all,
but it was a lot of reassurance. There was a lot of that. So as he came back tonight, okay. We obviously had to do our baseline observations, give her an assessment as to what injuries she actually sustained and whether we can treat any of those injuries. But all in all, it was more her emotional support.
I'm just going to take your blood pressure, because your other arm's sore, isn't it?
This one hurts.
Aye, so I'll
I
not
think
touch
it's
that one.
broken. He's maybe hurt me.
What did he do to your head? Did you go unconscious, Shelley?
I'm not going to lie about it yet.
Yeah, okay.
And that's when I woke up and all my neighbours were around me.
Okay. When we go to incidents with a female assault, that shouldn't happen at all, someone hitting anyone. Whether it's male or female, to be honest, no person should be assaulted in any way. So I was feeling quite anxious about as to what her injuries were initially, and just for her emotional state. So he kicked you about the head. He probably kicked you about the ribs then as well, did he? Listen, you're in safe hands now. All right?
Yeah, because people like that always get away with it. I've asked for help for years.
Has the police been involved? Have you reported all these incidents?
Yep. I'm not even with him anymore.
Right, just
just
try and relax. I can't see any bruising or anything like that there, but I need to listen to your chest just to confirm there's any other chest injuries. Might have cracked her ribs maybe, and that's why it's sore whenever time you move. I'm just going to have a quick listen, okay? We don't get trained in emotional support. Just breathe normally.
My heart rate's always good.
You just pick that up as you go along, really. It's probably life experiences probably gives you that emotional part. Right, your lungs sound very, very well.
I'll give you a couple of paracetamol to take with that, all right?
Can you help me, sir?
Give us your...
Right, don't you move, I will move for you. You've had a traumatic event. It's understandable. Where is it that's sore?
There, when I twist it.
Right, don't twist it then. I'm just going to have a wee feel, right? That's sore.
Here, it's uncomfortable.
So it's just here, tender. You able to move your wrist up and down?
Oh, no.
Okay, right, we won't do that now then.
It's like I have bruises on my fingers.
Yeah, but we need maybe a chest x-ray at the hospital, all right? And because you've been knocked out, all right?
I don't want to take up your time,
Listen, we're going back that way anyway, so don't worry.
No, but...
And the police are going to follow us up anyway, all right? I'll sit in the back with you.
Can't get any more water. I feel so dizzy right now. My head hurts.
Shelley needs to go to hospital where her injuries can be further assessed.
Just try and relax, all right? You're in a place of safety. No one's going to get you.
My head hurts.
I know. You've been, it's fine.
Jesus. Oh.
We'll get you belted up and then we can go up to the hospital, eh?
I'm sore.
We go to a whole range of people and you're very important. Every one of our patients are very important.
Thank you.
Right.
I'm not that worried.
Yeah. Right, let's go. She needed that extra support. Right, all your observations are all good.
Good, because I'm healthy inside.
Yes. You're strong inside. All right. So what team was playing tonight then? I'm not a football fan. Was it Man United? Is that the top that you've got on?
I just wear this because he told me to.
Okay. There is people out there willing to listen, because I think that's all I was there for, really, was to listen and support her.
Are you guys ready to get going?
Yeah, it's good to go. I'm gonna have to sit down.
It's okay.
Is
Yeah,
that all
you
right?
need to sit down, put a seat
I'm literally just there, right? You can still hold my hand.
Put a seatbelt on there, my girl.
Right, still hold your hand. I know. On the way into the hospital, she was really upset. Yeah, she wouldn't let go of my hand. We're nearly there. We're nearly there. She really needed our help at that moment. I hope that I gave her a bit of support with just being there and just listening to her.
I'm a good person.
You are. You don't deserve that. Right, that's us at the hospital. So no more bumps. You actually talked about her afterwards, isn't it? Because it kind of really stuck with us a little bit. Because it's not often we get those types of jobs, and it does make you think as to the situation that she was in.
Right, couple of bumps here, all right?
You very seldom get a boring day in this kind of job, so.
When I got offered the job with the service, I got offered another job in a bank, and I was like, do I go for a career or do I go for a bank job? So I chose the career, and it was probably the best decision I'd
You could have been
ever
a bank
done.
manager by now.
I could have done a bank manager.
A bump. And again.
Being in SORT, first and foremost, we're all paramedics. Just SORT's got a few little extra skills added in. I've definitely dealt with way more trauma in the 6 years I've been in SORT than the 22 years I worked at Division.
SORT often deal with the most traumatic incidents on Scotland's roads.
So what's happened? I think it's a motorbike versus a car, and the persons came off the motorbike and flew 10 foot in the air, she says. What?
So she's about to sit for a run day?
Aye. Motorbike accidents can be quite a dangerous form of RTC because the person isn't held onto the vehicle. You know, they're sitting on top of this bike. The minute it hits another object, they can come flying off. Where's that site hill, do you think?
Yeah, I think it's this side. We're close to it.
The potential for them to go flying up in the air, the potential for them to hit other vehicles, windscreens, the road is massive, and they've got very little protection compared to sitting inside a car, totally exposed. Oh, this is brutal, look.
There's single traffic down there. They just need to move over at this part.
Descend from 313301.
Oh, here we go.
Yeah, just seen what's in the job, medic one's required. Would you like me to know?
Is that medic one's required?
Yes, that would be perfect.
Due to the potentially severe nature of the patient's injuries, Medic 1, the trauma support team, have also been called to assist.
In a motorcycle crash, you could see injuries from very, very minor scrapes and bumps to the loss of limbs, people who are paralysed. Yeah, it's talk group 32.
Okay, I was just wondering. Perfect, we're chasing down to 32.
So Medic 1 have been mobilised and so's Crit Care, so it's not sounding too good.
Thank you, control that.
Oh no.
4095 to control. Could we get the fire brigade as well as the motorbikes leaking fuel all over the road over?
En route to the incident, the divisional ambulance had stated that the petrol tank from the motorcycle was actually leaking onto the road. So that poses a hazard in case that catches fire. Then you've got a whole scene that's really unsafe. 2751C.
I'm going to pull in front of them.
All the people down.
Oh, a student. What a shame. Is that a paramedic?
God knows, I can't.
I was talking to the guy. He's conscious. Kept the lights on.
Hiya.
Abdul, pain in legs, can feel legs, but I've got pain in them. Helmet was off when we got here. Bike has not been moved from where it is. Somebody tried to lift it up, they got told to put it back down, and he's ended up here. Someone was doing a U-turn and knocked him.
Pretty low impact, probably.
Yes,
It's not been high speed.
Really.
The patient had kind of skited along the road. They came into contact with a car, but it wasn't a high impact.
Nobody's seen it happen, so.
Right. You can't take anything for granted, so you do a head-to-toe assessment to make sure if they're in pain anywhere, if there's any limbs broken, if they can feel you touching them, make sure they've got all their senses.
Yeah, just here's the update there. So I'm at ERI.
At Glasgow Airport, the HeliMed team are preparing for a trip down the Clyde. In Millport, on the Isle of Cumbrae, a call has come in for a patient needing a transfer to the mainland.
Do they have an ambulance in Millport?
Yeah, there's one ambulance on island.
Oh, really? So they'll bring them, is that right?
Yeah, that should be the plan, yeah.
Their patient is a 15-year-old boy with a potentially worrying condition, meningitis.
It's inflammation of the barrier that protects your brain, the meninges. They can become inflamed and swelling can occur due to infection that gets in there. There's quite a lot of symptoms, signs of infection, so high heart rate, high temperature, high respiratory, low oxygen levels, sometimes low blood pressure. Common one that a lot of people hear of is a non-blanching rash at different points over the skin. They can be a bit drowsy, have a stiff neck, they can have cold extremities, quite a few different things, vomiting episodes. The list is quite long.
Your start is approved and you're cleared to Millport.
The worrying thing is it can go into sepsis.
Clear to start,
Treatment for it will be antibiotics. So the quicker that can start, the better. So if that can start in a rural setting, then fine. But most of the time for us, it's getting the patient to a bigger centre.
Yeah, I've just put a tiny wee dog leg in. Right, okay, because of the Hunterston power station. Yep, sure.
Hello, Gammox. HeliMed 5 here. Just departed Glasgow Airport en route to the Isle of Cumbrae. We've got 4 people on board, fuel endurance of 1 hour 50, and we should be there in 10 minutes. Thanks.
Roger, HeliMed 5.
The HeliMed team must travel the 20 miles by air to the Isle of Cumbrae, west of Glasgow.
Millport is a place where I used to go on holiday, and most people in the sort of Glasgow, west coast of Scotland used to go there because it's a lovely little place. It's only 10 minutes on the ferry from Largs, and Largs is at the end of a train line from Glasgow. But if you're ill, getting from Millport to Glasgow would be a ferry and nearly an hour of driving, whereas we are just over 10 minutes flying time.
15-year-old boy visiting there with some family friends, I think, and he developed a headache, bit of a temperature, bit of a fast heart rate. They can't do the tests and things that they need in the little small local hospital they have there, so he needs to get moved to the Children's Hospital in Glasgow.
Down there. Perfect.
The local ambulance crew are at the landing site ready to transfer the patient and a family friend to the helicopter.
How are you feeling? All right? Nice. Did you just arrive today on... Yeah. Oh, really? Oh, for God's sake, that's turned a bit stressful.
So we were sort of expecting him to be a little bit more alert than what he was. When we actually met him, he seemed quite quiet, quite reserved. Whether that's because he was worried or anxious, or whether it was because it was his illness getting more serious, it was a wee bit concerning for me.
I'll be careful I'm not taking my head injury as well.
All good, Ollie.
The flight to the hospital in Glasgow will be short, but the crew must still monitor their patient carefully.
We are doing a lot of things. We're doing respiratory rate, oxygen levels, pulse, blood pressure. We'll probably do blood sugar, temperature, and a GCS, the Glasgow Coma Scale. It's used worldwide, and it's just a way of measuring someone's consciousness level using how their eyes, their voice, and their motor responses are doing.
I'll come.
15 minutes after leaving Millport, the crew have landed in Glasgow.
You right, Danny? You okay?
You can take your headset off now. You manage?
Yeah, just give you a wee call when I need to go back to land.
Yeah.
Come and pick me up.
No fars. 45 minutes in the car. He was quite quiet, a little bit reserved. I think he was away with family friends rather than his parents, so maybe feeling a wee bit homesick, if you like. But he seemed all right. His observations had improved significantly than his initial observations.
Danny will be admitted to hospital, where they will be able to further assess his condition and test him for potential meningitis.
Oh, hold on if you like. If you're scared of heights.
It's the plan. Just to get him stripped, analgesia, access, and get him moving.
Right.
SORT paramedics Lee and Isla are on scene in the Sight Hill area of Edinburgh, where a man has collided with a car and come off his motorbike.
SORT team leader to Crick here. So we've just arrived on scene, and this looks like it's been a relatively low speed impact. However, the patient's not wearing any leathers. It's been a small moped that's been clipped with a car doing a U-turn. We're just ready to cut his clothes off and just assess any injuries, but he doesn't look to have any life-threatening injuries at this moment. Happy for Crick here to stand down. I don't think they need to do.
Do you have anyone on our vehicles getting pen trucks just now? Okay.
Yep, I'll get pen trucks. And
I'll get the trolley with you.
So, in SORT, we carry an extra pain relief that divisional crews don't have, and that's Penthrox.
Just to give him some initial pain relief just now until we can get him.
Penthrox should work good.
This is a pain relief that's taken through, it's called a little green whistle, and they inhale it. It's very fast acting and also very effective. You don't just give it out willy-nilly.
Just keep taking that, buddy, it will start to kick in.
We have got a protocol to follow. We only give this drug for traumatic injuries. He's been on a motorbike which has came into collision with a car. He was complaining of pain in and around his legs, so the potential for him to have traumatic injuries are there. At least the Penthrox can start working and can start on the pain.
It will help, but you've got to keep going with it. Big deep breaths in. Has he moved his limbs?
He can move his toes, but he's not moved his legs at all.
Jake, it looks like it's got a back brace thing in it. That looks like a biker's jacket, doesn't it? He's not
He's got leathers, he's just not worn today.
Aye.
So I think he's got a jacket.
I hate seeing people on motorbikes who are just scooting along with jeans on, jumpers on, and they've got no protection whatsoever, because if they come off the bike, their limbs could be getting dragged along the road and potentially could end up losing their limbs. You're spending all that money on a bike and a helmet, then surely you want the rest of your body to be protected as well.
It's been thrown quite a bit though, hasn't it? It's quite a distance with the bike.
Definitely.
So we're thinking about putting the pelvic binder onto the scoot before we put him on the scoot.
Aye.
So we're going to have to try and straighten him out first though, so...
We're going to try and straighten you out, so this could be a bit sore, okay?
With the patient receiving pain relief, the team must now assess the extent of his injuries.
So here where I'm touching.
I'm just going to bring this back up. Do you know what else?
Is it sore here where I'm touching? Hold on.
For these types of jobs, we've not got X-ray specs, so we can't actually see inside the body. So you just do a full, thorough head-to-toe examination in the hope that if there was something serious going on inside, like internal bleeding or, damaged organs, that their observations would indicate that.
It's not.
Here. Don't need to hold that as you're poking, put your arms in.
No life-threatening injuries have been identified. But getting this patient off the road and into the ambulance is a delicate task.
Luke, on your command.
Okay, on 3, 1, 2, 3. Keep taking.
Splendid. We'll do the same thing on the side. You have the other hand. All hands on. Right, Luke.
3, 1, 2, 3.
I've got a knee on the other side of the binder, so it should be good.
Maybe smash his kneecaps a wee bit.
This is going to be sore. Keep sucking on it.
That's it. Really well, buddy.
Very done. So there is no displacement of the patella itself on either side. The femur seems intact, no deformities.
The motorcyclist will be taken to hospital for further assessment of his injuries and treatment to his kneecaps.
We're good. On your command.
1, 2, 3.
I'll get a wee stroll for you, because we're going to be doing movement, all right?
That young boy was very lucky. He wasn't wearing any protective clothing. That could have been a whole lot worse. He could have came off with losing a limb or potentially being paralysed, if not dead.
In Inverness, paramedics Mike and Lauren are midway through a busy shift. They have been working together for the past 3 years.
When I first started, it was like your night shifts were decent.
Yeah, I know. It's gone crazy recently.
It really is.
It's massively important to get on with your crewmate. Knowing someone that will be on your kind of wavelength where, we could be in kind of life or death situations where you don't even need to discuss what's happening.
It's really important knowing that they've got your back.
Yeah.
Oh, it's like a red zone sometimes. It's job.
I know.
We're on the same wavelength and we just seem to work really well together.
Yeah.
All the time.
There's no dramas. Easy to work with. Gets the job done. Can't complain. We are going for a 95-year-old female who has diarrhea and vomiting. She's just going straight into the ward.
That is a shame.
Unless she's just not coping at home, maybe, as well.
I've been in here a lot recently. Right at the corner, isn't it? having somebody you can talk to is really important because you feel like you can be truthful and open and honest with them. Get through it together most of the time.
My name's Mike and this is Lauren. We've come to take you into hospital. Was the doctor out seeing you today?
I'll go speak to this.
No, sorry. Was the doctor out seeing you today? You're just feeling rotten? You're feeling rotten? You're not eating me at all, are you? It's okay.
It wasn't an emergency kind of situation. We had a bit of time to find out some information from Beth and I think it was her daughter that was in the house. So we could able to have a bit of a chat with them to find out what was happening and what had been going on.
She's not eaten anything since Monday.
Not eating anything?
Nothing at all.
Trying with the fluids?
Just tried the fluids, but really nothing.
Okay. Taking its toll?
Taking its toll, yeah.
Absolutely.
Both of us.
Yeah, you look knackered.
Yeah.
Speaking to the daughter, I think she missed out on quite a lot of her own family life because she had to stay with her mum because her mum wasn't able to get up and do anything for herself. So I think she was struggling herself as well.
She was passing out on the commode last night, but she doesn't know that.
Every time?
3 times.
Okay.
She was unable to mobilise around the house, so it was just she needed to go in for more probably respite than actual treatment. And being in her 90s, I'm sure she deserves that.
Yeah, absolutely.
The government expects the number of people aged 90 and above to double in Scotland over the next 20 years, potentially putting more strain on the country's health and care services.
We'll get in a chair.
Yeah,
we'll get her taken out. And are you going to give her phone in a wee while?
Yeah.
Yeah, that's fine. Do you want to...
She knows all that.
Yeah, she's quite happy.
You just wait there just now. Just wait there just now. We can pop your dressing gown on though. Do you want a wee hand? Yeah.
Here's your chariot.
Your bum there. You want a wee hand?
Yeah, you'll have to. She won't.
There we go. You happy with that? Yeah. Cool.
Beth will be taken to Raigmore Hospital,
Nice fresh air. Yeah.
where she will be admitted for further observations.
1, 2, 3, and shuffle onto that bed. You set that back up.
Mm-hmm.
That's the one. Go back or whatever.
See, a period. You got it right. We're quite dehydrated at the moment.
Yeah.
You okay? I'm tired. Yeah. Now that's going to get tight, okay?
Blood pressure 140 over 80.
We're going to take your temperature. .37.1.
Perfect, that's exactly the same as it was.
Into your hand. I'm pretty dehydrated. Good veins though.
Yeah, I know.
You got good veins. You like worms, yeah. I can tell.
She was certainly in her 90s, just a kind of wee frail, probably wee grandma to be honest. Yeah, I took quite a shine to her actually. I really liked her.
You comfortable enough? And you're warm enough? Yeah, perfect. Oh, this isn't good.
We're gonna have a wait, Mike.
We've joined a bit of a queue at the hospital, so we might have a wee wait, I'm afraid, okay?
So with the hospital wait times at the moment, it's very kind of up and down. Sometimes we can arrive and we're in straight away, other times we're not.
There's somebody else come in for one for here. Yeah. How long have you been here for? Oh, okay.
How long are we waiting?
You don't want to know.
Oh, really?
Things tend to go in an order, whether you're an ambulance, whether you're a car, whether you've walked. That's your position in the queue. Just because we're an ambulance, we don't get priority over cars.
Yeah.
Waiting times at hospital remain high. For Beth, that means staying in the ambulance until a bed becomes available.
We have a long wait. There's no spaces at all anywhere.
None at all.
They can't even give me an estimate.
Brilliant, okay.
Waiting for a long time with an elderly patient, it's important to reassure them that they are going to get into the hospital and we're not going to leave them by themselves because They always fear that you're just going to be waiting and waiting and waiting and it's never going to happen. So reassuring her was a big thing. And obviously we got snacks.
Yeah, we got snacks as well, just to keep us going.
We're going to have a fair wait. I don't know how long it's going to be, okay? What do you want? The bed down? Yeah, of course. You tell me when. How's that, yeah? Try have a wee sleep if you want. It's going to be hours, I think. It's going to be hours. No, honestly. We're here now, so hopefully it won't be too long.
Ambulance service, is the patient breathing? Is the patient awake? And what's the address of the emergency, please? Okay, tell me exactly what's happened. Okay. Right, okay. And is this related to his diabetes that he's collapsed on the floor, or do you think this is something different?
In ambulance control, Chloe is dealing with a call for a diabetic patient who is intoxicated and repeatedly falling outside a shop.
There's a lot of intoxicated people, and I think the problem is when you are intoxicated and you've got yourself to that level, if you are incoherent and you don't know where to go, if they are in a vulnerable position, if they are intoxicated, they can't just be left lying on streets.
Right, okay. And did he lose consciousness when this happened, or did he just fall? So did he lose consciousness at all when this had happened?
The caller has randomly come across the patient and is trying to get them medical attention.
If a caller doesn't know the patient, it can be really difficult for us to get the relevant information that we are needing. So that can make it all a little bit more challenging in getting the correct information to make sure we're getting the best help for them all.
Right, if someone's there, if they could just try and keep him awake at the moment, just try your hardest just to keep him awake. Yeah, don't let him fall asleep.
He kept going in and out to the shop where the staff were very, very concerned from him. He was diabetic and I think he was quite intoxicated as well. And he kept going in and requesting for the staff to get him some help. And then the staff would phone 999 and would have an ambulance all arranged for him. And then the gentleman would leave the shop and not want the ambulance. So it's really difficult because you know that someone needs help. It takes a lot of convincing and it can be challenging.
It's hard of breath, okay. And is he responding normally? So would you say, is he completely alert? Okay, does he have difficulty speaking between breaths? No. Is he changing colour? Right, okay. We need to do a quick test on him for the medics before they arrive.
Chloe will take the caller through a fast test.
So there'll be 3 questions and then it'll give you 3 answers. And that'll kind of tally up whether it's a 1, 2 or 3 on how severe their symptoms are that this could be possibly going as a stroke.
So I just want you to get close enough to ask him to do 3 things. Just tell me when you're ready. Okay, so just first of all, ask him to smile. And was the smile equal on both sides of his mouth? Okay, now just the next one. Ask him to raise both arms straight out in front of himself and hold for a moment. Was he able to raise and hold both arms equally?
I've keyed in all the information. It'll shunt us to another question and it'll tell us if it's partial evidence, strong evidence, or no evidence of a stroke at all.
Okay, and just the last one. Ask him to say, the early bird catches the worm. Was he able to repeat it correctly? Was it slurred, garbled, or not understandable?
So it's really important that we always do these fast tests if someone mentions that they are having stroke symptoms, just to make sure that we know exactly what's going on.
Okay, and exactly what time did these symptoms start? Okay, has he ever had a stroke before? Okay. I am organising help for you now. Now, we are experiencing very high call volumes at present. We will respond as quickly as we can, but at the moment in the area, we have got significant delays, which can be anything up to 2 hours at the moment. Is it possible at all for the patient to be transported to hospital in another way?
It's very difficult having to tell someone there's a long delay in the area. It's not a nice feeling. Okay. We let them know the average delay time. If they're happy to wait for the ambulance, of course we'll get somebody sent out to them. Okay, listen, we will get someone out to the patient as quickly as we can, but that's the average delay time across the whole area at the moment, okay? And most of the time people would rather wait for a crew to get there just in case something does go wrong on the way to hospital, which you can completely understand. Now, I do need to hang up to take another call, but that help's all been arranged. If he does become less awake and he vomits, quickly lay him onto his side, and if you feel that he gets worse in any way, just call us back immediately for further instructions and we'll get someone there as quickly as we can. You're welcome. Take care now. Bye-bye. Bye-bye. We've had a few calls in for this patient already. When they're phoning for an ambulance for him, the patient's then refusing for an ambulance. But he's came back in, after leaving 2 hours ago, he's came back into the shop and now agreed that he does need some help. They said that he was breathing a little bit better, but with his slurred speech, he could be possibly showing some stroke symptoms, and he's had a previous stroke before as well, they said. So, but hopefully this time that's him and he just stays where he is and waits for the crew to get there so that they can check him out and get him checked over.
Bit upset. Yeah, a bit upset. Yeah, that's okay.
40 minutes after arriving at hospital in Inverness, 95-year-old Beth is still waiting in the ambulance.
Hopefully this will help. And you'll be home soon, hopefully. Okay? I think it's frustrating. You turn up to patients and 9 times out of 10 there is not a bed waiting. There is a bed when it's available. It's a completely different story.
Taking someone out of their home and then having to lie in an ambulance bed or chair for hours on end when, you know, they're more comfortable at home. I'd rather be at home than sitting in the back of an ambulance myself. I think with the waits now, it's almost become normal. At the start it was frustrating, and it's now, it seems just common life.
We wait here most of our shift sometimes, just to get our patients in because there's no beds in the hospital. It's very frustrating. It's very frustrating for us because we can't do anything else, and it's very frustrating for the patient sitting in the back of an ambulance for numerous amount of hours.
Just checking that everything's okay there at the hospital there.
Our patient's quite happy. She's just having a wee snooze, and at 4 o'clock we're going to phone the flow manager and see what they're saying as well.
Fingers crossed. Hopefully they'll get in soon.
I think the 3 ambulances are at the front of the queue at the moment.
If we can do anything from this end, just let us know, and if I hear anything else, I'll let you know. Over.
Yeah, that's all received. Thank you. Yeah. But we'll wait and see.
Over an hour after arriving at hospital, Beth and the crew are still waiting outside.
You want a cup of tea?
Any tea?
Tea. Milk? Just milk. Just milk. Milky tea or builder's tea? Milky tea or strong tea? Weak tea. Okay. So I made a cup of tea for a start. I went in, made a cup of tea, took it out to her, and it was amazing. She didn't have any complaints. I've got it. I've got it. It should be not too hot. Good? I'm making not a bad cup of tea. And Mike thought, I'll go make a cup of tea for her. And yours, she actually said yours was horrendous.
Yeah, it was the worst cup of tea she'd ever had.
Had enough?
Is that all you need, is a cup of tea? Yeah, magic. That's what I wanted to see. Nice thumbs up.
90 minutes after arriving at hospital, an advanced nurse practitioner comes to assess Beth in the ambulance.
Hello.
Hello.
So, she's normally on Buckerstem.
Uh-huh.
Has she had any today?
I don't know.
I don't think she'll be able to keep anything down today.
Okay, it would need to be IV.
Yeah.
Okay. If we were to get some maintenance fluids on her, is that how it would work for you?
Yeah, we can hook it up and monitor it, that's fine.
Well, I'll write up a litre bag and we'll just get some maintenance going,
Aye.
and her potassium's a wee bit low.
Okay.
Okay.
Is that okay?
Yeah, perfect.
Fine.
With no hospital beds available and a long wait ahead, the advanced nurse practitioner provides some fluids to start Beth's care.
We're going to give you something for the sickness. Okay, so we're going to give you... It's just, we'll give it to you through here, and then we're going to give you some fluids to make you feel a bit better, okay? Okay. Considering we'd waited a long time, she was in good form. She was in good form and quite happy to chat to us for hours.
Danstram, 4 milligrams to 11.25.
Yep.
Cool. We did have a bit of a laugh, and there was, you know, that kind of frailty about her, but there was still the kind of cheeky side of it as well, which I think we both found really, really enjoyable.
Beth, this will stop the kind of sicky feeling that you're getting, okay?
You know, she's just a nice wee old lady that you don't want to be waiting with for hours on end, because it's not fair on her.
You feeling okay? Yeah? Still feeling sick? No? Good. Hopefully that medication will start to work soon. Okay?
After a 4.5-hour wait, Beth is finally admitted to the ward.
Couple of wee bumps, Beth, okay?
It's a little bit bumpy.